Dr. Amit Saraf from the Pink City of Jaipur, APICON 2022. I head the Department of Medicine and Patient Safety and Quality Control at Jupiter Hospital, Mumbai. I had a talk of a very important topic known as diabetes and sarcopenia in this particular conference. Very, very important and yet a neglected topic by most of us, to be honest. Sarcopenia is defined, the Greeks had got it first, they called it poverty of flesh. Today we have many definitions. The easiest one is basically the appendicular skeletal muscle mass divided by height square. If it's less than 2 standard deviation, which is acceptable for an individual's age, height, weight and gender, that's defined as sarcopenia. In simple words, when patient comes to you in an OPD with type 2 diabetes, check their hand grip, simple hand squeeze when you shake hand, or if you want more scientific, it's a dynamometer study. Make them walk for 4 meters, do a gait analysis, do a DEXA scan, see their appendicular skeletal muscle composition and strength. Simple test, a simple thigh, mid-thigh circumference over the period of time if it's decreasing as the patient is following up with you. These are measures to define and call a patient sarcopenic if he's falling into these criteria. Remember, there's an entity known as pre-sarcopenia as well. So if you can catch them on a DEXA study at pre-sarcopenic level, we can try and control their sugars a little better. What's the link? As we are all aware, muscle is the largest mass of sugar burning. It takes up sugars, it burns the sugars. So the moment there is a poverty of flesh, muscle wasting, so to speak, the sugar burn, the entire uptake of sugars in that large pool of muscle is going to be decreased. That is going to be adding to the blood sugar levels of your patient and thereby leading to diabetic complications and hyperglycemia. Diabetes itself can also beget sarcopenia by pro-inflammatory processes, atherosclerosis, decreased blood supply to the muscle. So thereby it's a linked situation. One can propagate the other and the other can beget the other. So controlling both is important, diagnosing both is very important. Treatment per se is mostly counseling to your patient that a sedentary lifestyle is going to add to the muscle wastage. Asking them not to go on a fad diet, because most of these fad diets are going to decrease weight by both reduction of fat and muscle mass. So the more muscle mass they lose, the more sort of sarcopenic they're going to become. So advocating them that to go in for a proper diet with a proper dietitian and after consulting your physician. A functional training exercise regimen wherein the muscle strength is important. Elderly people, look into their protein intake, look into your vitamin D levels. So put it all together. I think sarcopenia has to be looked into rather than sarcopenia looking at you. You have to advocate a lot of lifestyle modification. You have to impress upon a patient the importance of exercise, vitamin D supplementation and protein intake. Thank you so much. I hope to see you all next APICON 2023 in Ahmedabad. Thank you.